all of you colleagues, especially Honorable MEC for Health, Ms. Nomagugu Simelane Zulu, the government officials present here from both the Premier's office as well as the Department of Health, members of the media, ladies and gentlemen, thank you for honoring our invitation to bring the province and nation up to speed with the recent developments regarding COVID-19. This is our first public engagement since we entered the historic, exciting, and hopeful new chapter of vaccinating our healthcare workers against COVID-19. We would want to deal with the issue of vaccination. We are extremely pleased to announce that, as expected, none of our healthcare workers have suffered any complications since taking the vaccine from Thursday onward. Instead, these troops, who are our first line of defense against this virus, have reported a renewed sense of positivity, confidence, and feeling more protected against COVID-19. This is a major psychological boost and a far cry from the fear and anxiety that they have been experiencing while relying on nothing but non-pharmaceutical preventative measures. Now, for the first time, they can walk tall and focus on attending to their patients, knowing that the vaccine, as well as other standard preventative measures, will keep them safe and spare their life. We are indeed privileged to be living through such times. In terms of progress, since we launched the vaccine, since the launch of the vaccine, we have vaccinated a total of 1,279 healthcare workers or health workers. This is made up of 319 healthcare workers at Prince Mshiyeni Hospital on the first day, followed by 480 the next day, and in Inkosi Albert Luthuli Central Hospital, we had vaccinated 80 on the first day and 400 on the next day. We do believe that this is a good start, although we are urging healthcare workers to take advantage of this vaccination program in all or in their large numbers. We would like to see these numbers increasing in view of the fact that COVID-19 infections and death have not yet stopped. We remain committed to ensuring that every category of healthcare worker in the public and private sectors will eventually be vaccinated. With regard to infections among the healthcare workers, our call for healthcare workers to come forward and get vaccinated is an important one, given the rising COVID-19 stats, insofar as these important foot soldiers are concerned. As of yesterday, a total of 15,829 healthcare workers have been infected with COVID-19 in the public sector since the beginning of the pandemic. The majority of these infected healthcare workers were nurses at about 55%, and of the total infected, 335, which is 2%, have sadly succumbed to the disease. May their soul rest in eternal peace. In terms of the update on the status of COVID-19 in KwaZulu-Natal, on Saturday, yesterday, the 20th of February, which is the latest reporting cycle, KwaZulu-Natal recorded a total of 313 new COVID-19 cases. eThekwini district recorded 33% of these cases, followed by Umgungundlovu at 17% and Uthukela at 12%, to mention just these three districts. The province continues to rank the second highest in terms of number of laboratory confirmed cases countrywide, contributing 326,703, which is 22% of the total number of cases countrywide. We have continued to observe a remarkable decline in the number of new cases weekly. The overall percentage change in the number of new cases between between week 5 and week 6 was a decline of 45%. The actual number of cases was 6,898 for week 5 and 3,801 for week 6. So you will see that this decline has been there, and it is quite a good decline. The decline in numbers of new cases occurred across the province or in all districts. The average number of cases recorded in the past 7 days remained below 500 cases per day, with a 7-day moving average of 327 cases. The province observed a further decline in incident risk in districts across the province from 61 to 34 cases per 100,000 in the past 14 days. The overall proportion of recoveries from the province is 93%. The proportion of recoveries in all districts is above 80%. With regard to hospital admission, as at the 19th of February, the province had 1,523 patients admitted in both public and private, with 1,155 in private hospitals and 368 in public hospitals. Of those admitted, 278 patients required intensive care services, and private hospitals had more patients in ICU than the public hospitals. Public fatalities by district, admission in the public hospital per district, we have presented it. It must be noted that in terms of district facilities, we can report that we're still at a good level. But before that, let me take you through the numbers. At eThekwini, the admission is around 157, Umgungundlovu 42, Umzinyathi 16, Ugu 27, Amajuba 13, Uthukela 18, King Cetshwayo 10, the Zululand 29, Ilembe 12, Hirikwala 29, and Umkhanyakude 15. That makes the total number of admission to be 368. In terms of bed occupancy, of total available COVID-19 dedicated isolation bed, 12% were occupied. Of the total ICU beds, about 22% was occupied in public hospital. We still therefore have enough beds and would want to send a message that it's clear. Let us ensure that we report to our public health care facilities on time. In terms of the developments, all of these are the good developments that we have seen. We would want to welcome all of these developments, and they are an indication that the second wave is subsiding. Finally, we can breathe a sign of relief, given how bad things have been over the past few weeks and months, especially the many precious lives we've lost, as well as the impact of COVID-19 on the economy. But we must also behave responsible, and take note of the possible third wave. As we have cautioned before, one infection or one death due to COVID-19 is one too many. The reduction in these statistics does not mean that we must now rest on our laurels. Now is not the time to celebrate or drop our guards or be complacent. COVID-19 is still here, and it is a deadly disease. There is the ever-looming threat of the third wave of infection that we need to guard against, especially as we approach the winter month. And about 9,464 deaths, we remain concerned that our province continues to rank the third highest in terms of fatalities across the country, following Eastern Cape and Western Cape. With regard to the issue of hijacking of two nurses near Thornville, we also wish to take this opportunity and condemn in strongest possible term the hijacking of two nurses near Thornville on Friday morning. These nurses, aged 32 and 42, were part of the HIV and AIDS roving team from Umgungundlovu and had been transporting patients in the Hopewell area. When they got to a remote part of the road, they came under attack from three armed men who were traveling in a white bakkie. The men blocked the nurses' path and forced them off the road, adapted them, and drove to a secluded area where they took their valuables, including handbags and cell phones, and then dumped them near the bush. They then took off in the nurses' state vehicle, a white Toyota Avanza. While we are grateful that these nurses were not physically harmed during this incident, it is nevertheless left them with psychological scars that will take time to overcome. This is a very barbaric, shameful, and cowardly act, and we urge any individual who might have information about this incident to urgently contact the police, who will treat that information with utmost confidentiality. While the vaccine is being rolled out in the province and in a form of academic study, we are also taking into cognizance the utterances on social media and radio platforms which have tried to make the Johnson & Johnson vaccine appear as if it is not legitimate, just because it formed part of an academic study. We really need to tread carefully around such matters and discourage people from making statements that have the potential of undermining a lot of good work that have been done by government to bring the vaccine to our shores and to give our people hope for the first time in the fight against the pandemic. As a society, we cannot go from the desperation of being devastated by COVID-19 with no cure to now having people discrediting the vaccine with no scientific basis when it comes to an effective answer to the virus. That is just being irresponsible, and we need to discourage that. Let us take this moment and clarify this matter. And this, in line with the established procedure, the South African Health Product Regulatory Authority is unable to register and license the Johnson & Johnson vaccine before it is registered by the drugs regulatory body in the vaccine's mother country, which is in the United States of America. This process might take a few weeks, which we cannot afford and wait for that process to be exhausted. However, because we are in a race against time, South Africa has made the decision to expedite access to the vaccine for healthcare workers who are at risk of infection by using the only mechanism to access the vaccine at this point, which is now being rolled out through this phase of study. Once the vaccine is licensed locally, then it will be rolled out like any other vaccine available to the public without the need to enroll all vaccine recipients. It is just a technical matter that takes nothing away from effectiveness. And I think that must go straight and be important, that it takes nothing from this effectiveness of the vaccine. We want to make a statement that let us not be complacent. We urge and remind the people of this province and our country that lowering of the rate of infection and deaths does not mean that the virus is now now dead. The virus is still there. We need to think very carefully and internalize this reality so that we do not suffer from the same fate that we did when the first wave appeared to be subsiding late last year. Many will remember how the second wave ambushed many of us in December, and we were not so much expecting it at that time. People have given themselves a false sense of security, so much so that even when as government we are issuing warnings for people not to congregate in large numbers or attend funerals in large numbers or having parties, but you will find that some will still go ahead and do those things. Many of these super spreader events resulted in loss of many lives, which was most unfortunate. So we need to exercise self-control even now and continue to behave like people who are in mourning, which we are because we have lost a number of people. The unstable daily COVID-19 infection numbers, even though they are now lower than before, but are clear signs that we are not out of the woods as yet. Now is the time when we should be looking after ourselves even more than before as we await our turn to take the vaccine. We urge all health workers to ensure that they are registered for vaccination in both public and private sectors. This is important so that we can roll out the next phase of vaccination smoothly. Even after being vaccinated, we will have to continue observing standard precautionary measures such as wearing face masks when venturing out in public or when we are among the elders or people with comorbidities. We will need to continue washing our hands with soap and water, sanitizing, and practicing social distancing. With regard to the SOPA, as we conclude, we wish to remind the people of our province about our state of the province address for 2021, which will take place on Friday, the 26th of February, this coming Friday. This year's SOPA will focus on a number of critical issues, such as job creation and unemployment, as well as creating a healthy province that is free of COVID-19. The people of KwaZulu-Natal can share their suggestions and input on what they wish the SOPA to focus on by sending us direct messages to the kznsopa@gmail.com or use video WhatsApp and send to our WhatsApp number, which is 072 366 89 444. Thank you.
Thank you very much, Honorable Premier. We are then going to go straight to questions. I'll start with the colleagues in this room, and the colleagues that are on Zoom will give an indication via our group if there's anything that they want to ask. Can I get an indication of hands? Any question? Inoki Bonga, Vusi. Any other hand that I'm missing here? Okay, we'll just take this round here, and then yeah, we'll see if there's a follow-up. Bonga.
Thank you. My question for my client for mute. The question is for the MEC. MEC, I'm just interested in a scenario where the healthcare worker says, the doctor and nurse, no, I don't want to take a vaccine. Is there, have you played out what happens as a healthcare worker? Do you continue as normal or just trying to ascertain what happens?
Okay, my question is related to the premier. He said the number of reductions or decreases in the number of aspects, including better meeting and other decreases that he also mentioned. What could be the reason that form those reductions in numbers, as well as the numbers of infections?
Do you have anything on Zoom? Okay. Okay. We'll hand over to Junior and Mercy.
Good afternoon, ladies and gentlemen. Fortunately or unfortunately, both the questions still fall to me. Having said that, I do have one point I wish to speak to before I respond to the question, and I think it's a matter that we unfortunately left out of the premier speech, and it's an area that needs to be clarified. In the past couple of days, we have seen on social media a number of GPs complaining that the MEC or the Department of Health has actually stopped them from getting vaccinated and had to turn them away. Now, we do want to correct that and firstly indicate that it is extremely unfortunate that people who are held by the society as esteemed as doctors, some of them would actually peddle untruths as it has happened. Now, with the vaccines that we received 10,800 vaccines. The Department of Health at a national level indicated only on Friday that 30% of that is 30% that is supposed to go to the private sector, which means the doctors or the general practitioners that are in the catchment area are supposed to be the ones to be given 30% of the vaccines. Now, before that arrangement was properly made with the national department, some GPs from all over the province and not even in the catchment had decided to go directly to the two facilities and make appointments so that they could be vaccinated. We appreciate the enthusiasm, and it's something that we call for and we encourage. But we have had to indicate to them that the vaccines that have been received are vaccines that are meant for health workers in that catchment area, meaning the catchment area of Nkosi Albert and the catchment area of Prince Msheni Hospital. So health workers, nurses, doctors, cleaners, everyone in that catchment area, including the clinics of Prince Msheni and Chief Albert, will be vaccinated within the number that has been given. But that also includes the GPs that are in that catchment area. So we wanted to clarify that on Friday, Mrs. Msimango, who's the Deputy Director General in the province of KwaZulu-Natal responsible for clinical services, met with the organizations that are representing doctors, and they agreed that they will provide a list of GPs in the catchment area who are going to start to be vaccinated. And the meeting is going to have a follow-up meeting tomorrow so that they are able to get the proper list and things are done properly. So we just thought it's necessary to clarify that, because it would be very unfair to have GPs coming from Umkhanyakude to get vaccinated when you have doctors that actually work in Umkhanyakude in the Department of Health but have not been vaccinated. So we do need to be able to spread the vaccine around, and we are trying to do that in the best or in the fairest way possible. So everywhere where we say it is a center, that center becomes the catchment area. So all health workers, including the private health workers in the catchment area, they belong to that. I wanted to just clarify that first. Let me then go to the two questions that were raised. Ubonga is asking a question on what happens where there is a scenario where a health worker refuses to be vaccinated. And I believe we have had a couple. Firstly, and this is something that the president and the minister have always indicated, that vaccination, no one is going to be forced to vaccinate, but we are all required and requested to vaccinate so that we are able to reach that herd immunization percentage that is needed. So when to be vaccinated, we accept that, and sometimes we get the health worker to be spoken to, see what are the challenges, what are the fears. Are we able to assist with the fears? Are we able to cancel the fears? Often we find that we are able to cancel the fears, but there are times where we find that they just really do not want to be vaccinated and we can't force them. So in a case where a health worker refuses to be vaccinated, we don't force them. Of course, there are processes that needs to be followed. And I think that's important to clarify. And then I'm glad you asked that question, because it also emphasizes the point that even with our own people, no one is going to be forced to be vaccinated, but we are making a plea to our people that can we please be vaccinated, because should we not have the herd immunity by the time winter comes, as Premier was talking about a possible third wave, which might happen in winter, it might really happen in winter if we don't have this herd immunity. And the only way we can have herd immunity is when more than 70% of our population is actually vaccinated. So it is a plea we are making to our people. That's why we have had programs to get myself and the Premier at different platforms, different levels, where we have been explaining what the vaccines is about, what does it mean, how does it assist in the body itself, and how all the other issues that some have raised as issues that are affecting COVID-19 are actually not true, because we are trying to allay the fears of our people to say, please take the vaccine. I mean, we give you an example of the mumps. Majority of us, when we were young, we did not actually get the mumps. And the reason why we didn't get the mumps is because when we were born, we were vaccinated for the mumps. But the generation before us, almost all of them got the mumps when they were growing up, because there was never a vaccine for it. So it's something that we always need to clear with our people, and without being forceful, but we must be able to give the correct information, and which is why we appreciate this platform with the Premier, with yourselves, because we then get an opportunity to explain things succinctly where some of the issues are not clear, and where you believe we've not been cleared, we've not been properly clear, you also ask us questions that give us an opportunity to clarify some of these things. Thank you very much with those questions. The last one is from Vusi. Is talking about the number of reduction of beds. Vusi, Premier, when in his speech, when he says we have started using less beds, he's talking about COVID-19 beds in particular. Remember when we were hit with COVID-19 in March, generally as a province, we don't have the 6,000 beds that we've always been calculating. As a province, we have more than 25,000 beds in the whole province. But we then had to decide in each facility how many beds are going to be put aside, and these are going to be COVID dedicated beds. So as you see the infection rate going down, it literally means you also see those that are sick enough to be admitted in hospitals their numbers are also going down. That is why we then have less people. Sorry, that is why we have less beds being utilized, because those that are sick that needs to be hospitalized, some need that might need ventilation, some that might need oxygen, are not as many as they were, say, around end of December, for instance, which is where I believe we have our highest numbers. That is when we utilize the majority of our beds. Fortunately, as a province and the public sector, we did not find ourselves in a situation where we did not have beds at all. Of course, there were a few hospitals that ran out of beds, and when those hospitals ran out of beds, we were able to move patients around within the same districts. We had a plan that said, should a district run out of beds altogether, we can then move the patients to the next district. And I think I explained this particular issue a few weeks to yourselves as well. So the reason why we are now not utilizing as many beds for COVID-19 as we were previously is because people that are infected and are sick are not as many anymore. Why? Well, it's a scientific issue. Why we've gone? It's purely because we've gone past our peak. Our peak was when we had 6,900 infections in one day, and the Premier spoke to that. And after that, immediately after that, we started plateauing and we went down. And even the even the admissions in our hospitals, you could see that there were less. However, having said all of that, there are people who are still going to pass away from COVID-19 if they don't go to hospitals as soon as they get symptoms. And we still insist that when you get symptoms, no matter how minimal you think those symptoms are, go to a health facility. It must be someone who is a health worker who says to you, you only have this or that, and you can manage that at home. And what we've also done is create a booklet for those patients who manage themselves at home to read. And it's unfortunate that we probably didn't bring it with us. We will bring it to you next week so that you can see it. You go through that booklet. It tells you step by step what to do when you are faced with certain scenarios. But those that come to our facilities, we find that their oxygen is low, their sugar diabetes is too high, the BP is problematic, and so forth, then those we admit. So you'll find that even within the 360 that has been was infected yesterday, you will find that a couple of them are quite sick, and you know, they would have to go to the hospital, they will have to go to a clinic, and some might have to be admitted. That is why we say, even though our numbers are low, as soon as you get symptoms, please go to a health facility so that it's a health worker that is able to determine whether you can manage yourself at home or you need to go to a facility. Thanks.
Thank you very much. We're going to welcome the Premier to the questions that we got online. I think the MC covered it around the GP from Sunday Times. Okay. And the Daily News was asking what had already been covered by the Premier, but we share the statement as well. Thank you.
Thanks, Mr. Mabaso Sibingelele. Siyafisa ukunibonga ngokuba nathi la namuhla. Okokuqala siyafisa ukugcizelela ukuthi njengoba siqalile iprogram ye-vaccination, siyabonga ukuthi akaze kube khona okwenzekayo like kuba kunama complications kulabo asebe-vaccinated. Siyabonga ukuthi abahlengikazi nodokotela nezisebenzi zomnyango wezempilo ziqalile i-vaccination. Since siqalile sekuvaccinate KwaZulu Natal abantu abangu-1,279 zona zombili indawo esiyisebenzisayo okuyi-Prince Mshiyeni Memorial Hospital ne-Chief Albert Luthuli Hospital. Siyafisa ukubonga ukuthi iningi lezisebenzi kumnyango wezempilo zisithathele phezulu lelu hlelo lokuvaccinate. Siyafisa ukugcizelela kubaluleke kakhulu ukuthi abantu bakithi bakuthole i-vaccination, especially abahlengikazi nodokotela, ngoba ibona basekhaleni laleli. Uma nje sibheka izolo ibalo zithi kwi-public sector sesiluze or sesibe nama-infections amaningi ama-infections awi-public sector nje kuphela asebe u-15,829 wama-healthcare workers and u-335 wabo udlulile emhlabeni. So kubaluleke kakhulu ukuthi labo abasebenza ey'bhedlela baqinisekise ukuthi bayayithola le vaccination. With regard of i-update, siyafisa ukusho ukuthi izibalo ziya ngokwehla iy'balo ze-infection. Njengamanje singasho nje ukuthi izolo sirekhode about 313 cases okuveza ukwehla kwey'balo. Noma zehla kodwa ayikapheli futhi i-COVID-19 khona futhi iyabulala. Kumele sibheke sizivikele. Sinama-district amathathu ahamba phambili kuma-infection rate kulezi insuku okuyiTheku elirekhode 33%, uMgungundlovu 17%, uThukela 12%. Uma ubheka ukwehla kwey'namba ngesonto lesihlanu, the 5th week of this year, siyabona ukuthi kusukela kwisonto lesihlanu kuya kwisonto lesithupha iy'namba zithe ukwehla. Ngesonto lesihlanu zaziwu-6,898 but ngesonto lesithupha zehla zaba ngu-3,801 okuyi-decline ka-45%. Siyakuncoma lokho kodwa kubalulekile ukuthi sihlale sazi ukuthi i-infection ne-infection iyingozi and ukudlula koyedwa umuntu kufana nokudlula kwabaningi. So asiqhubeke sizivikele. Kuyasidabisa futhi akusiphathuneze kahle ukubona abantu bengayilandeli imigomo ebekiwe. Basaba namaphathi kwezinye iy'ndawo, imingcwabo uthola ukuthi i-attendwa ngabantu abaningi abangaphezu kwesibalo esibekiwe. Konke lokho kufida kulento ye-super spreading, kube nama-super spreader events, and siyafisa ukuthi sikugweme lokho ngoba baningi abantu bakithi sebedlulile emhlabeni ngenxa yalesi sifo. Mangigcizelele ukuthi imibhede ey'bhedlela zethu ehlelelwe ukuthi nje idile ngqo ne-COVID-19 isekhona kwiKwaZulu Natal yonke. Njengamanje i-occupancy rate ey'bhedlela iko-12% and i-occupancy rate yalezi bhedlela or yembhede le ekwi-ICU yona iwu-22%. So siyagcizelela ukuthi abantu bakithi mabaye ey'bhedlela kusenesikhathi. Siyafuna ukusho ukuthi kukhona ama-developments athi iyehla i-second wave, kodwa le second wave ayikapheli, but i-COVID-19 ayikakapheli isekhona, and therefore masizivikele sonke. Siyafisa ukugcizelela ngoba ikhona ne-threat yokuthi kungekudala singase sibhekane ne-third wave, especially uma sekungena ubusika. Ngifisa ukuthatha leli thuba sibheke ngayo yonke nangawo wonke amazwi ethu ukukidnapwa kwabahlengikazi ebebesebenza endaweni yaseTonville eMgungundlovu ebebehambisa iguli endaweni yaseHopewell. Siyafisa ukusigxeka lesenzo esibi kangaka ukuthi abantu besilisa bahayijekhe abantu besifazane baze bathathe izinto zabo ey'fana ney'khwama nama-cellphones. Siyacela kwabangaba nolwazi lwalaba ukuthi bariphothe emaphoyiseni aseduze nabo. With regard to i-Johnson & Johnson being a study njengokushiwo, siyafisa ukugcizelela ukuthi angeke kusize ukukhuluma ey'nkundleni zokuxhumana sigxeka ukuthi le vaccine iseyi-trial. Ayisizi leyo nto ngoba abasho lokho abasho ukuthi ayikho effective, phela bathi iseyi-trial. So asingehlisi uyithemba kubantu bakithi, as-encourage abantu ukuthi baye bayothatha imigomo. Ngiyafisa ukugcina ngokugcizelela kulolu lesihlanu esiya kulo sizoba ne-state of the province address, simema bonke abantu bakithi ukuthi babeke imbono yabo ebhekiswe ekutheni njengesizwe yini ebalulekile okumele sibhekane nayo njengoba uhulumeni waKwaZulu Natal. Yonke imbono ingasubmithwa kwi-website, kwi-email yethu ethi kznsopa at kzn or at gmail.com. kznsopa@gmail.com. Thank you. Siyabonga.
Thank you very much, Honorable Premier and MEC. We come to the end of it. I understand Uvosi ufisa ukukhuluma no-MEC, but we are going to release the Premier because he's got an urgent commitment. I also want to apologize to the colleagues from that are doing the video shoot. We'll do tomorrow. Okay.